We have with us today Nyssa Swanson. She graduated from Oakridge High School in 2010. She went to Ferris State University on the TIP scholarship in pre-physical therapy, and she was accepted to the University of Michigan-Flint in physical therapy. And Nyssa Swanson is now Dr. Swanson.
Oh my.
Dr. Swanson. I'm trying to work Zoom, Dr. Swanson.
Nobody really ever calls me that, just so you know.
I'm going to call you that. I am going to call you that, Dr. Swanson. And she has decided to come here today to talk to us all. And we are really, really lucky. We are going to have like about a 45-minute discussion, whatever Nyssa's up for, about her life and how it's being impacted by COVID-19. Everything. You can ask questions. Raise your hand. Does everybody know that if you go down to the bottom and it says participants, you can raise your hand. There's a little hand raise thing, and I'll watch the hand raise thing, and then I will click you so you can talk to Nyssa. And then you can just ask your question. And I'm sure she would be more than happy to answer your question. Does anybody have any questions on how this thing works? Our goal here is to it's to learn more about what Oakridge students who are out there in the world dealing with this pandemic, how they're doing. And so Nyssa Swanson, take it away.
Right. So I didn't prepare anything to say. It's just going to be ad lib here. But I just got done working my shift here at Sparrow. I work on Mary Free Bed. It's an inpatient rehab unit. That's where we work with several patients who have had strokes, motor vehicle accidents, traumatic injuries, brain injuries. And we've actually just started recently taking COVID patients as well. So we're beginning to treat post-COVID is what we're calling them, patients. So patients who were positive, who were on a ventilator for several days, who have now tested negative and are in the recovery phase. And we're working with these individuals to, bring their mobility back and their strength so that they can return home to their family. Anybody have any questions about that?
Actually, I think that you guys can just ask them too. I don't know if you have to be recognized. If you feel a break in the action and you want to just ask Nyssa a question, what was her school like? What was her life like? What is her life like now? Anything that you want, feel free.
Do I have to raise my hand first?
No, you can just identify yourself.
Oh, hi, this is Jagger Smith. I was wondering, what trying to get a job in like the medical field now, because like I know they're like asking for a lot of like retirees to come back out of retirement, and they're wanting more people into the like medical field right now. Is it like really hard now to get in there though because of the whole COVID thing, or is it like to start up? I mean.
So I would say, initially we had some physical therapy students and some medical students who were supposed to graduate this year, and their final test put off because of that. And so it's hard for new graduates to kind of get into the field right now, but as things return back to normal, it shouldn't be any different than it was before. And it's a lot easier to ask somebody who's retired to come back than it is to ask a new student who hasn't been able to take boards or anything like that to come in prematurely. But everything should return back to normal. There's always going to be a high demand for people in the medical field. So I don't anticipate that being a problem in the future.
Can you guys mute your screen if you're not asking a question? It's kind of giving feedback.
Does that answer your question?
Yeah, it does. Thank you.
Yeah.
I have a question, Nyssa. When you were a good student at Oakridge, you qualified for the TIP because your family was impoverished.
Right.
When did you think that you might want to go into physical therapy?
When I was at Ferris, my first year, I actually thought that I wanted to be a respiratory therapist because I was afraid of student loan debt. And a respiratory therapist is an associate's degree, which is kind of crazy considering all the things a respiratory therapist does. But I was like, okay, 2 years, an associate's degree, I'll get out and I'll start making money and I won't have that much student loan debt. And then I researched what a respiratory therapist does, and they do a lot with, suctioning trachs and placing trachs and working ventilators. And the idea of mucus coming out of somebody's mouth is probably the most repulsive thing to me ever. And I experienced that while I was in school and decided that that wasn't for me. And I took an aptitude test and I found physical therapy. So it was about halfway through my first year when I realized that I wanted to do physical therapy, back when me and Rachel Stewart were roommates. Good old days.
She is here. Questions? People, do you have questions?
I have a question.
Who identify yourself, please.
Sorry, it's me, Rachel. I have a question for Nyssa.
Yeah.
Can you talk about, do you remember, can you talk about, applying for scholarships your senior year? I mean, all of it, right? Just how we were so stressed, but,
yes.
There were times where, though, we would be writing essays and it was like, this could be $5,000.
Right. Yeah. So I was definitely more motivated to fill out scholarships when I was in Mr. Wood's class and when I was in my senior year than I was applying for grad school. And I wish that I would have carried that over with me, because the amount of money that's sitting out there waiting for you, you just have to research and look for it and put the time in, is pretty huge. And it is exhausting. But now, if I wish I didn't have as much debt as I do now in grad school, if I would have taken that initiative like I did when I was, a senior in high school, because it's good. It's a good experience, and that information that you learning how to write for scholarships, learning how to talk professionally, in an adult sort of world is invaluable. Is that kind of what you meant, Rachel?
Yeah, and when you say that, I was thinking that too. There was a scholarship I could have applied for when I went to, and I just didn't, because I was like,
yeah,
why?
Right.
But I remember, I think still, I don't know if I've ever been as stressed as I was that senior year, but it was totally worth it still.
Yes, I would agree. I don't know. We were pretty stressed in grad school. I don't know.
That's true. Yeah, but you guys should know, Nyssa was working 2 jobs while we were in high school. I had one little job at McDonald's with her that I thought was a lot, and she would go every other day at a different job and go to school and still apply for all these scholarships. And it was a busy time.
It is busy. It is busy. So right now, go ahead.
No, I wondered if you could share how much debt you did end up graduating with. And now you live with your boyfriend. You guys have an interesting, you're paying down. Oh, you're engaged. Oh, I'm sorry. Sorry. Your situation of paying down your debt. So you want to share a little bit about that?
Yes. So when I graduated from Ferris after 4 years, I had about $8,000 in debt, which is nothing compared to how much school costs. And that's because of all the scholarships and all the grants and everything and working. When I graduated from PT school, the $8,000 turned into $116,000 over 3 years. And it's kind of overwhelming to think about. And I knew that that's what was going to happen, but I knew that it's what I wanted to do. And that I was a smart financial planner and that it would be okay. Right now, I currently have about $76,000 in debt. And it's something that, so I'll just say that going to college and taking on that much debt is not something that you should take lightly, because they give it out so easy. Mm-hmm. They will easily just hand you a loan. And it's so much harder to pay it back. So I would just definitely weigh, all of your options and understand how much debt you could end up with, and make sure it's what you want to do. Because my brother, for example, has a lot of debt in college, and he has a degree that he's not even using right now. So paying back his debt is a lot harder because he's not using his degree and he's not making that much money. And it's something that it follows you around. It affects how you're able to buy a house. If you want to buy a house someday, it affects getting your own car and all those things. And it's a serious thing. And it's your first adult decision, you know, is going out and getting into that debt for school. So I would just not take it lightly. All right, is everyone scared now?
I have a question. So I'm going out of state for college. Do you think that's a good idea to go out of state, or do you think that I should go to like community college first?
So it depends. So what are you going out of school for? What is?
Point Park University in Pittsburgh for forensic science.
Okay. So if it is a specialty college where that's where they specialize, you know that's where you want to be. If you have connections there, that's even better. If you can live with somebody and, you know, not have to take on the debt of paying for a place to live, that's even better. There are pros and cons to both. There's obviously a pro to staying at home, going to community college, saving that money, because out-of-state tuition, it costs more. But if it is a field where they're going to specialize in forensic science at this university, and it's, you know, it's definitely something that you want to do, then I would do it. I don't think that, you know, the money should stop you if you know that's what you want to do.
Yeah, I understand that. Thank you.
Yeah.
Can you tell us what you did today?
Yeah, so I'm pretty much scheduled every minute of the day. I come into work around 7:30. My first patient is at 8:30. So I spend an hour chart reviewing. If I have any new patients, you know, what they did the night before, if anybody had a fall, if anybody's status has changed. We have patients who are have weight-bearing restrictions because of orthopedic injuries. We have patients who have dietary orders, NPO, nothing by mouth. Because they have a PEG tube placement, you know, are those still in place? So that's what I'm doing in the morning. And then I'm scheduled 4 patients in the morning before lunch, 45 minutes each. So I have patients who have had strokes. I have patients who are nonverbal because of brain injuries. And then I have COVID patients right now. So in the morning, we're working on gait training, which is walking, stairs and car transfers, those types of things. And this morning I actually had a Zoom meeting with a family member. Right now we're not allowed to have any visitors up here at all. And if you are not lucky enough to have a smartphone, which we have a lot of, you know, people in our population up here who are 70 plus who don't know how to work a smartphone, don't own one. And the only face-to-face that they get is the Zoom meetings that we set up for therapy. So in the Zoom meeting, we were showing the family, you know, their progress and just kind of letting them see each other face-to-face. And then I have lunch in the afternoon. It's pretty much the same thing for other patients and Zoom meetings. So for example, one of my patients today with COVID, her family was able to see her walk for the first time, and she was able to eat her first meal since she had her PEG tube out. And a PEG tube is a tube that is placed in your belly to give you nutrition because she was on the ventilator for so long. Her vocal cords and all of the muscles that assist with swallowing, they got weak, and so she isn't able to swallow properly. But today she was able to have her first meal. So we get to share moments like that with patients, and it's pretty great. So today was actually a really good day.
Don't be bashful, people.
I have a question. I'm Soli. I was wondering, like, obviously outside of like stricter safety precautions, like what are the major changes that have happened like at work for you?
Right. So we haven't been able to have family up here, and we rely a lot on family to help patients get home sooner than maybe what they normally would. So if I can get a wife in to help her transfer her husband, you know, if it's just a little bit of minimal assistance or cues for safety, he can go home a heck of a lot sooner than if he has to figure all that out by himself. So that has delayed a lot of our discharging. It's definitely put more on the plate of the therapist, because now I have to organize Zoom meeting calls with all these family members and explain how to use Zoom to a lot of people. We have to wear a face mask. As soon as we walk in the building, the only time I'm supposed to take it off is when I'm eating. So I'm not supposed to have it off at all. And then I wear a face shield that just goes across my head like this, and there's a shield in front. And I have to wear that anytime that I am interacting with a patient. We wipe down a lot more things, but generally in the hospital, we have pretty high standards for sanitation and how we take care of things in the gym. So in terms of, you know, protocol and procedure, that hasn't changed that much. It's just getting into the hospital that's different. So we have to be screened, our temperature is taken every day. I come in early to get through all of that. But then once I'm up on my unit, the face mask and the shield are pretty much the only things that are different. And everything else is business as usual.
I have a question.
Who?
Cameron Dial.
Okay.
What do you think is the biggest challenge that you've had so far while working because of COVID-19?
Biggest challenge. The thing that I'm noticing the most is anxiety in my patients. So even though the hospital is one of the safest places to be because of the screening process to get into the hospital and the sanitation and the safety precautions with the masks, 75% of my patients have become highly anxious because they're not getting to see their family. They're worried that they might get COVID if they're here. They think that we might give it to them, especially those who are cognitively impaired because they've had a stroke or a brain injury. It's something that's definitely hard to work with. So I spend a lot of time, you know, talking people off the ledge and trying to convince them that they're okay and that they're safe, and, you know, that we're doing everything we can to make sure that they're successful here. And it's an exhausting thing in and of itself. If you spend every day talking to anxious people, it makes you anxious too, and it makes you exhausted. So that's probably one of the things that's the most difficult for us therapists to deal with right now.
I have another question. It's Jagger. What has been like the economic kind of like impact on like your work and like your life because of this whole COVID thing?
Right. So kind of two answers there. So personally, half of our unit has been redeployed to different areas of the hospital. So we do not have as many patients coming in. So that means somebody who has diabetes, who maybe has a foot wound, they're not coming in to get that checked out right away, or somebody who has COPD, they might be having some more breathing issues that they might normally come into the hospital to have assessed. They're trying to deal with those things at home. So we're seeing less patients come in, which means we have, you know, less beds filled. We need less therapists here, and more of our therapists are discharged or just put off into different areas of the hospital, redeployed to do jobs such as screening patients as they come in, or cleaning or something like that. And if all those spots are filled, then they are laid off. Luckily, I haven't been one of those therapists yet, and I hope that we're kind of turning the corner there. But a lot of my coworkers have been redeployed with less hours, or are filing for unemployment because they're not getting any hours. So that would be more of like the personal level, but a big picture of the hospital, we get emails every day that update us kind of on the status of where we are economically. And the last email that I got projected that they thought we were losing about $1 million a day in profit, because surgeries such as a hip replacement, a knee replacement, those surgeries are not taking place, which means those people don't need, you know, follow-up services to recover. Any sort of elective surgery is not taking place. They're canceling a lot of follow-up appointments. and all of that is money lost for the hospital.
You,
I have a question.
Oh, go ahead.
Okay, I'm Mackenzie Swartz. How many years of schooling did you do, and what classes did you have to take?
Right, a lot. No. So when I was at Ferris, it's kind of like a basic biology degree. It's kind of the same courses they send you through if you're going to be a nurse, if you're going to be a pharmacist, if you're going to be a physical therapist, occupational therapist. It's this general biology degree that you get. And then they just call it whatever you're going into, pre-nursing, pre-physical therapy. So a lot of science, biology, chemistry, math, those types of things. And then once I graduated, then you go into it's an extension, so it's 7 years total, 3 years year round. You don't get summers off, and it's all physical therapy based courses. So treatment, diagnosis, neurology, all the different disciplines, pediatrics, and you just go through each one and learn the specifics of how you would treat each patient population. So that would be different depending on what grad school you decided to go into.
Okay, I have a question. I'm Delaney Land. I was wondering, so you said you just recently started taking in like COVID-19 patients or post-COVID-19 patients. So I know, right, like physical therapy is like where you help someone after an accident, something like that. How do you help post-COVID-19 patients then? Like, what's that like?
Good question. So a lot of these patients are presenting as if they would have any other chronic respiratory issue, like somebody who has COPD, emphysema, something like that. So they're not necessarily having any injuries that are like a broken leg or anything like that. These people are cognitively with it. They understand what's going on. They're just weak, and their aerobic capacity is low, which means that they're not able to draw in enough oxygen to just do a basic task like stand up or walk a few feet. So a lot of it is endurance training. We are monitoring their oxygen, their heart rate, their blood pressure, and sitting. We're walking with them, usually on oxygen, to see how far they're able to walk. We're keeping track of that distance, and then we're monitoring their vitals again to see how they reacted to those distances. And the goal is to increase distance or increase what they're able to do each session.
This is Skylar. I was just wondering why you went into the medical field.
Right. So the medical field seemed like a safe place to go. So you're always going to need the medical field. I like the medical field. I like Grey's Anatomy, even though this is nothing like Grey's Anatomy. But you know, I enjoyed it. I enjoy understanding the human body. And it's a safety thing as well. I knew that I probably wouldn't ever get laid off, or, you know, the hospital probably wouldn't ever shut down. So it's a safe place to work, especially if you're in a union, that you're probably going to be safe and always have a job. And I like that. I like that security, especially with my background of, you know, coming from a disadvantaged family and, you know, not always being secure.
I have a question. How has your personal life changed at home because of COVID-19?
Right. So I live with my fiance right now, and things are different, just like they are, you know, like we don't go to the store that often. I only go out to get groceries. He doesn't usually leave the house. The most different thing would be probably how I enter the home after I've come home from work. So we have a very specific sequence of how things are done. I call him when I'm close to home, and he corrals our dog into another room, and he shuts all the blinds, and he goes to another room. And then I strip in our garage, and I put everything in a plastic bag, and I run to the shower, and I clean myself. And then after that is done, then I'm allowed to see my fiance and my dog again. just because there's still so much unknown about how long, this lives on surfaces. If somebody has it around me and I don't know it, the last thing I would want to do is bring it home. So that's probably the most odd thing about what it's like at home. Otherwise, it's just like anybody else, any of you at home, what it's like.
This is Mr. Wood. I have a question. I remember when you first started working after you had your degree, you went to Flint General Hospital, and there were a lot of chaos and a lot of emergencies and a lot of gunshots, a lot of tough stuff. And then you moved into a different field where it was much more sedate. You were moving around, and you always said that you liked the hospital atmosphere.
Yes. So I make more of a difference here than I do. I have a lot of friends who are obviously physical therapists that I graduated with who prefer the outpatient setting, working with athletes. I worked with athletes when I was at Ferris. I worked under the student athletic trainers there. And it's not like it wasn't rewarding. It's just not as rewarding as when you are working with somebody who hasn't been able to walk on their own and you're able to help them take those first steps, or somebody who hasn't been able to eat in a month because of weakness and now all of a sudden they're able to eat. That's why I do this. And it just seems so much more impactful. And I feel like I earn my paycheck at the end of the day. Like when I go home, I'm like, oh yes, today was a good day. I did good. Whereas when I was doing home care therapy, that's where you drive around and you'll go to somebody's house who maybe isn't able to get out. Those people, you normally aren't changing their behavior. Usually what it ends up being is you are somebody that they don't get to see. They don't get to see that many people because they're stuck at home. They can't drive. And you're kind of more like a social worker, or, just somebody for them to kind of talk to rather than making a physical therapy impact in that setting.
Thank you.
Yeah.
Hi, I have another question. This is Jagger. I was just wondering, has anybody you've worked with contracted COVID, or have you guys all been safe?
We have had one. So just on my unit, we have had one person. There was a patient that me, an occupational therapist, and a speech therapist were all treating. And the speech therapist actually contracted COVID from this patient. We did not know they had it. They came up to us before they started widely testing our patients before they got to us. And in speech therapy, when you're trying to teach somebody how to talk again, it's really hard when you can't see their mouth, right? Like if I can't show you how to pronounce something, it's a lot harder to learn. And so there was a lot of cheating where he would have to pull down his mask, and he ended up contracting it. Now he's fine now. He's back to work. Nobody else in his family contracted it. And that has been the only instance on our unit where it has been transmitted.
On that issue, you told me that they called you because they tried to trace it back.
Exactly. So this is a patient who was on our floor. She had a cough. She had a cough the whole time she was here. And we were thinking, well, they obviously, tested her. She came with a cough. Didn't really think that much of it. We had masks on. I wash my hands a million times a day. So I was like, it's okay. And then this patient was discharged on a Friday and was readmitted to the hospital on Monday with a positive COVID test. So then from there, they track every single person who had an interaction with this patient. They're looking through the chart to see, when did you treat them? This is when you interacted with them. You have to self-check yourself for symptoms twice a day for, 2 weeks. So yesterday was my last day of checking my temperature twice a day and reporting it to my supervisor. So luckily, I obviously didn't contract it.
Okay, I have another question. I'm Soli. So like you said, you had to monitor your symptoms. Was there anything other than your temperature that you had to monitor and like report back, or was it just that?
So there's a general list of symptoms that they want you to be looking for, and they've just added rash to that. The list keeps growing. It initially started with a dry cough, a sore throat, fatigue, and it has kind of just grown from there to kind of include anything that would be like an allergy symptom, itchy eyes, runny nose. They just added a rash to it. So there's something called COVID toes, where you get a rash around your feet. I don't understand it, so I can't answer any questions on it, but that's just a symptom that they added to our screening this morning.
Good questions, guys. These are really, can you talk a little bit about what you see, I guess, not necessarily politically, but in regards to how this state or how society goes forward in a reasonable and healthy process to deal with the future of this disease?
Yeah, so I know in our hospital, we're definitely changing the way we do things. Odds are that we're going to be wearing masks for over a year, and probably face shields as well. And we're definitely tightening the reins on allowing visitors, and they're starting to implement restrictions on caregiver travel and that sort of thing, where you have to self-quarantine if you left the state or if you've traveled within the state. And I think that there's going to be tighter regulations on things like that, especially in places like public hospitals, or public spaces. There's going to be more of a limit on those types of interactions. However, I don't know what the answer is going to be in terms of just publicly in general, how to open up safely, what that's going to look like. I've heard a lot of different ideas, and it'll be interesting to see how this changes, what the new norm is, definitely.
I have a question. It's Cameron. What do you do with your mask and your face mask and all that stuff after you've been around someone with COVID?
Right. So everybody on our unit is supposed to be tested for COVID before they arrive. It implemented after the case that we had on our floor. So nobody should be tested positive at this point. So the protocol is, if you're doing face-to-face treatment with a patient, you have a face shield on, and you would wipe that off in between each patient. And at the end of the day, you would wipe it off and store it in a bag. This face mask is what you are given after you've completed your checkpoint to get into the hospital. You don't have a fever or any other symptoms. They give you this, you leave it on. At the end of the day, you can take it home and you can just dispose of it however you want.
Hi, this is Jagger. You might have answered this already, but what do you think is like the biggest challenge for you at your work right now? Like, what's the biggest thing that's like the most like difficult?
So we kind of talked about that in terms for patient care. It would be that my patients are very anxious. Personally, it would probably be the fact that with having a low census and having a lot of our beds open that normally aren't, usually we're always at capacity, is not knowing like when is it your turn to be laid off, because you don't know. You don't know if we're going to have enough patients for you to work the following week. You don't know if you're going to get the call, the night before that they don't need you. And that's very stressful, just like it would be for anyone. And so probably if I wasn't talking about patient care directly, that's probably the most stressful thing that this has brought, is the uncertainty of, if you're going to be working on this unit or not. Because if you're not, then you might have to go and screen, and that's definitely not something that you would want to volunteer for, because you're seeing everybody, COVID or not. You don't know if they're tested. They're coming to you, they're telling you your symptoms, and then you decide if they go get tested or not. And definitely not a job that I would sign up for if I had the choice.
Are you getting, this is Mr. Wood again, are you getting, do you guys have access to enough masks? Do you have access to enough tests? Do you have access to the things that you need to take on this virus in the future?
We do right now. So they were worried that we wouldn't have enough simple mask. This is called a simple mask. You've probably heard on the news, they've talked about N95 masks. Those are the masks that you would wear if something were airborne. That's something that you would wear, like if somebody has tuberculosis, TB, that's the type of mask that you wear, an N95 mask. So every day we get an update as well. I get like 10 emails a day. I'm trying to find the email right now so I can tell you the numbers. And they tell us how much of a supply we have of each thing. And so it'll tell us how many days do we have until we run out of masks, how many days do we have until we run out of wipes. We use something called a purple wipe, which is actually with the medical name of it, a purple wipe, and it is the type of wipe that sanitizes all surfaces. So for today's update, at our current hospital capacity, we have enough N95 masks for 25 days. And we have enough simple masks for 144 days. Now, if we were at full capacity, then that number would change to N95 to 14 days and the simple masks to 83 days. So there's a whole team, and their whole job is just to try to find us supplies. So knock on wood, for right now, we're okay.
It's Tanner. Do you believe that there's going to be a second wave of this virus?
I wouldn't doubt it. I mean, there's obviously still cases popping up every day, and we have social isolation going on. So I imagine when they start to open up the state more, we're going to see an increase in cases again. That just makes sense statistically speaking. I don't know the answer in terms of if things start to simmer down again, are we going to see another boom of this in the fall like we do with the flu? I don't think that we know the exact answer for that just yet. There's a lot of speculation among, epidemiologists that know a lot more than me, but it wouldn't surprise me.
This is Jagger. I was just wondering, like, obviously, like, the general, like, public, like, was kind of, like, caught off guard by this whole thing. I was wondering, were you guys in the medical field, like, already worried about it, or were you kind of in the same boat as everybody else where you were kind of, like, caught off guard by it, and you didn't realize how bad it was going to be?
Right. I'm going to be honest. I think that the hospital in general, we obviously knew about it and it was being monitored, but just like much of the general population, it's not something that we necessarily took seriously until we saw how out of control things got in Italy. And then that's when a task force was formed here. This is not something that has been in the works since January by any means. I think end of February, early March is when things really got serious here and when everyone realized that, this is something serious. So I would say it's kind of a little of both. It was something that was monitored, but just, if you would have polled all of my coworkers back in February and asked, if they thought it was a big deal, I bet you it would be 50-50 what the response would be.
This is Delaney again. So has anybody like in your family or like your friend's family, has any of them contracted COVID-19 or any of them passed?
Luckily that I know of, no, nobody has. I do know of the coworker, obviously, and some of my coworkers' family members have. But luckily I don't know anybody in my family personally that has.
How do you, excuse me, do you enjoy what you're doing right now with this whole COVID-19 thing?
Yes, I definitely do. Sometimes I do feel guilty that I'm here at work, and I know I have a lot of friends who aren't able to work. because, it's obviously, it's a hard time to be in right now, especially if you're not able to work from home and you have a job that is a job that it can't be open, if you're a bartender, if you're a hairstylist. So there's that guilt there, but I wouldn't change the position that I'm in. There are days that I worry about, if I contracted it, but I feel pretty good with what I'm doing, and I feel safe here at work, and I still enjoy my job as much as I did before all of this happened.
This is Skylar. I was just wondering, like, when this is all over, do you think that this will, like, go back to normal, or do you think that everything will be, like, changed?
I think things will be different. They definitely will be different here at work. We've already gotten emails that said to not expect there to be a going back to. It will be a moving forward. There's going to be protocol in place that is going to change in terms of, maybe a screening process, face mask, that sort of thing. And I think that that's going to have a ripple effect around, privately owned businesses as well. People are going to be worried about, are your carts sanitized? Did you wash your hands? I just think that things will definitely be different.
How's your dog doing?
She is the best therapy ever. I recommend a dog if you need companionship right now.
It's Delaney again. So what's the most, because you probably work with a lot of people, what's your most inspiring story that, like, you helped someone get through?
Oh man.
Good question.
This was probably back when I worked in Flint. When I worked at Hurley Hospital in Flint, we had a patient who was not a very responsible guy. He was an older gentleman who was drinking, and he fell into a bonfire drunk, which caused him to have third-degree burns to 50% of his body. When you get at and above 50% total surface skin burns, third degree especially, your survival rate is very, very low. On top of that, he was withdrawing from alcohol. So he was a very complicated patient. He was delusional for a lot of it. He was having DTs, tremors. He was a handful. And once he started to recover, he had to have skin grafts. And when you get a skin graft, the most successful type of skin graft is when they take skin from your own body to cover your wounds. And so the second half of his body that was unburned then became the donor sites. So by the end of it, like, every inch of his body had some sort of wound on it, whether it was a donor site wound or the actual burn itself. I was with this patient the first time he was able to talk when he was taken off the ventilator. I was with him the first time he was able to eat solid food. And I was with him the first time he was able to take steps with a walker. And we cried together every single time. And he eventually went to rehab and then went home with his girlfriend and is living a pretty functional life. He can get around with a walker. And he can go long distances in a wheelchair, and he's still very stubborn, and he's still a pain in the butt. But he, like, nobody thought he was going to make it. Nobody did. But we had a great team that was working with him on the burn unit, and he survived it. And that's why you go into the medical field, for that. You don't go into the medical field, for the same old. You go in there for those extraordinary days, where you help save somebody's life. And so he is probably one of my favorite patients.
We have time for a couple more questions if you have questions.
I have one. It's Mackenzie. Who in your life has motivated you to get you where you are today?
Did Mr. Wood pay you to say that? Definitely Mr. Wood is one of them. So he was somebody who sought me out in high school, and I don't know if you know how close me and Mr. Wood are, but he let me borrow his car to take my driver's training test because I was driving around without a license because I didn't have the money to take it and I didn't have a car good enough to do a driver's test. He was my co-signer for my very first loan. I got a loan to get my certified nursing assistant degree or certificate, and I needed somebody to co-sign for a loan, and he took me to the credit union and we got a loan for that, and he's always been there. And if you're a good person and you have good intentions and you want to get somewhere, he is the guy who will get you there. So there's been a lot of great people along the way, especially teachers at Oakridge High School. But by far, Mr. Wood stands out among all of them.
And you came to my dad's wake. My dad died 2 years ago. Thank you, Nyssa. That was sweet. No, my dad died 2 years ago, and it was a snowy, real bad day. And I turned around, and there was Nyssa Swanson with her fiance, and you drove all the way over from Flint, and that meant so much to me. You guys, if you're looking for a role model, this is your role model. I mean, she was the hardest working kid I ever had. Honest, and just reached for everything you could do to make the world a better place on a regular basis. And you just knew she was going to go out and she was going to change the world and make it a better place. And it doesn't matter what hand you're dealt, what cards you're dealt, your little sperm and your little egg, it came together in a first world country, baby. You can be in one of those masks up at Sparrow Hospital looking at the crazies protesting out in the Capitol as well. So it's so good to have you. God, I'm so proud of you. I'm so
Thank you.
So proud of you. Do you have any final advice to these guys? They're juniors, mostly juniors, a couple seniors, where they are in their life and where they're going.
Yeah. So no matter how this turns out, it may affect your graduations. It may affect the next school year. It is nothing that you can't get past, and it's going to be a great story someday. So this is kind of like a once in a lifetime thing that you get to be a part of, and you get to choose, how you spend this time. And the fact that you're all here and you're participating in school, even though, school is very different right now, says a lot. And don't let any of that motivation go just because you're not in the classroom, because this is an important time, and it's not time that should be wasted. So I'm so glad that you all came, and I was worried that nobody would ask me questions or be interested, and all of your questions were great and they were spot on. So, just keep working and keep doing what you're doing right now.
Thank you. And she's right. The questions were excellent. You guys really did ask some good questions. This was excellent. It was very, very well done. And thank you so much for being with us today, Nyssa Swanson.
No problem. Thank you for having me.
Okay. Take care, everybody. I don't have the little bell. Class is dismissed. You can stick around if you have any questions for me. Otherwise, you can go. Make sure your assignments are posted by 11:59 Sunday night. And if you have any questions for Nyssa, any further questions, Dr. Swanson, if you have any further questions for Dr. Swanson, we'll be glad to get them to her. So just contact me, or I'll get her email to you. So thanks everybody for coming to our first Coping with COVID series special. Cool. Thanks.
Cool.
Bye, Nyssa.
Hi.
I'll talk to you later.
All right, we'll talk later.
All right, bye. Bye, Mr. Wood.